Today we're diving into one of the most incredible frontiers in all of medicine, neuropharmacology. We're going to break down how we can use chemistry to quite literally rewire the brain and treat some of the most complex disorders out there. It all really boils down to this one question, and it's a wild one when you stop and think about it. How can one tiny little pill completely change the way we think, feel, or even move? To get to the bottom of that, we first have to understand the language the brain itself is speaking. So let's get into it. All right, first up, we need to explore the brain's fundamental communication system. You can think of it like a really delicate, intricate dance between electricity and chemistry that makes, well, everything you do possible.
The absolute star of this show is the neuron. This is our brain's messenger, and it basically speaks a two-part language. The first part is an electrical pulse, like a spark zipping down a wire. And the second part, that's a chemical message it sends out to the next neuron in the chain.
So that electrical spark has a name. It's called an action potential, and it's just this beautifully choreographed sequence of events. It all comes down to the movement of charged ions. So a signal comes in, and boom, channels fly open for sodium ions to rush into the cell. Then, just as fast, those close and potassium channels open up, letting positive ions rush out to reset things. And see that fourth step, hyperpolarization? The potassium channels are just a little slow to close, causing a brief dip. That tiny little detail is actually crucial for timing when the neuron can fire its next signal.
Right, so once that electrical pulse makes it all the way to the end of the neuron, it triggers the release of these chemical messengers. You've heard of them. They're neurotransmitters. And their job is to jump across this tiny little gap called a synapse to deliver the message to the next cell in line.
And you know, for all their complexity, these messages really just boil down to two main commands: go or stop. Glutamate is the brain's main gas pedal, telling neurons, okay, fire. GABA, on the other hand, is the brain's primary brake, telling them to calm down and hold back. Our mental and physical health completely depends on the delicate balance between these two signals.
So what happens when this perfectly balanced system breaks down? Well, that's when things can go wrong, and it's where we start to see some of the most challenging neurological disorders emerge. Let's take a look at what that means.
You can pretty much group these communication failures into three main buckets. Sometimes there's just not enough of a crucial signal getting through. Other times there's way too much, like an electrical storm raging in the brain. And in some cases, the hardware itself, the neurons and their support systems, is actually physically damaged.
And this gives us a really clear picture of that too little versus too much problem. In Parkinson's disease, the brain literally loses the neurons that make dopamine, which is essential for controlling movement. The result is a major signal deficit. But with epilepsy, it's the exact opposite problem. The balance tips way too far towards excitation, causing this runaway electrical storm that results in seizures.
And then you've got diseases where the system itself is damaged. With Alzheimer's, you have these toxic proteins, beta-amyloid plaques that build up outside the neurons, and tau tangles that form inside, that basically just gunk up the works and cause widespread cell death. In multiple sclerosis, it's different. The body's own immune system starts attacking the myelin sheath, which is the insulation around nerve fibers. It's like stripping the plastic off an electrical wire. It just short-circuits the signal.
So, if these diseases are fundamentally problems of communication, how in the world do we fix them? This is where we get to open up the pharmacist toolkit and look at all the clever strategies for turning the brain's volume up or turning it way down.
This here is basically a fantastic cheat sheet for neuropharmacology. If you want to turn up a signal, you can do a few things. You can make more of the messenger chemical, or you could stop the cleanup crew that normally gets rid of it. If you want to turn a signal down, you do the opposite. You can just block the message from being received in the first place. Every single drug we're about to talk about uses one of these core strategies.
Okay, now for the really cool part. Let's see how we can apply this toolkit to fix those specific communication failures we were just talking about. All right, so with Parkinson's, we know the problem, right? The brain needs more dopamine. Simple enough. Except you can't just inject it. The brain has this incredibly strict security checkpoint called the blood-brain barrier, and it absolutely will not let dopamine through the door.
So, pharmacologists came up with this brilliant plan, basically a heist. Instead of trying to force dopamine in, they use a precursor molecule called levodopa. Levodopa is disguised to look like an amino acid, which is one of the brain's essential building blocks. So it gets an all-access pass right through a special transporter. It is the perfect Trojan horse. But the plan isn't complete without a bodyguard. Carbidopa is a drug that rides along with levodopa, but it can't get into the brain itself.
Its only job is to block an enzyme in the rest of the body that would change levodopa into dopamine way too early. This makes sure that the maximum possible dose of levodopa actually reaches the brain before it transforms into the dopamine that's so desperately needed. It's genius, really.
Now for epilepsy. The whole goal is to calm that electrical storm. Remember GABA, the brain's primary brake pedal? A lot of anti-seizure drugs work by making that brake more powerful. But there's another really clever strategy, which is to target those sodium channels we talked about at the beginning. By basically holding them in their off state for just a little bit longer, these drugs stop the super fast repetitive firing that causes a seizure, but without messing up normal communication.
Treating something like Alzheimer's requires a two-pronged damage control approach. To help with the symptoms, some drugs work by boosting a different neurotransmitter, acetylcholine, to help improve memory and cognition. But the real game changer has been in treating the underlying cause. Brand new antibody therapies can act like a microscopic cleanup crew, seeking out and removing those destructive beta-amyloid plaques. It's a huge step forward.
The progress we're seeing is just incredible, but there are still major challenges ahead. Let's take a quick look at that final frontier. We keep coming back to this blood-brain barrier, and for a very good reason. It is the brain's ultimate bouncer. It's a tightly sealed wall of cells that protects our most important organ. And while that's obviously essential for keeping us alive, it's also the single biggest hurdle for getting new medicines to their targets inside the brain.
So how do you get past this bouncer? Well, there are three main strategies. You can make your drug small and fat-soluble, which lets it kind of dissolve right through the cell membranes. You can pull the Trojan horse trick like they did with levodopa and disguise your drug as a nutrient the brain wants. Or you can try to find a backdoor entirely, like using an intranasal spray to bypass the barrier altogether.
And just to give you an idea of how effective this barrier is, think about this. Over 98% of all small molecule drugs that could potentially treat brain disorders are blocked from ever even getting in. More than 98%. Overcoming that one challenge is the key that could unlock treatments for countless other conditions.
But with every challenge comes incredible innovation. Our toolkit is getting bigger, our understanding of the brain's language is deeper than it's ever been, and the strategies we have for rewiring these circuits are getting more and more sophisticated. It just leaves you with this one really hopeful question. What's going to be the next big win in this field? Thanks for diving into this with me.